Feeling a constant pressure in the chest can be an alarming sign that your body is fighting against lung cancer, one of the deadliest diseases known. Why is this pain often ignored until it is too late? What if you could detect and combat this invisible threat before it takes over? Subscribe to the channel for more updates and enjoy this video if it is useful to you. There's another way to support our content. See the comments. Make a difference to someone's health by enjoying this video. Your collaboration helps us bring health information to more people. Lung cancer is one of the most common and serious forms of cancer, responsible for a significant mortality rate worldwide. It is characterized by the uncontrolled growth of abnormal cells in the lungs, which can eventually spread to other parts of the body if not treated in time. There are two main types: small cell lung cancer, SCLC, which is more aggressive and spreads quickly, and non-small cell lung cancer, NSCLC, which comprises the majority of cases and grows at a slower pace. Understanding these categories is crucial for determining the appropriate therapeutic approach and for improving patient survival rates. The importance of recognizing lung cancer symptoms, such as chest pain, cannot be underestimated. Chest pain associated with lung cancer can be a sign that the tumor is pressing on vital structures in the chest, or that the disease has spread to the pleura, the membranes that line the lungs. Other common symptoms include persistent cough, changes in voice, unexplained weight loss, and fatigue. Early identification of these symptoms significantly increases the possibility of successful treatment, as it allows for medical interventions at early stages, when cancer is more treatable. Therefore, educating the public about these signs and encouraging regular medical consultations are essential steps in the fight against this devastating disease. Chest pain, a common symptom. Chest pain is one of the most alarming and common symptoms of lung cancer, manifesting in various ways depending on the stage and location of the tumor. In many patients, this pain is described as a constant sensation of pressure or tightness in the chest, which can be aggravated by deep breathing, coughing, or laughing. This discomfort can be the direct result of the tumor pressing on the lung tissues, the surrounding structures in the chest, or the invasion of the pleura. As the cancer progresses, pain may be felt in other areas, such as the shoulders, back, and even the abdomen, reflecting the possible spread of cancer to these regions. Furthermore, chest pain associated with lung cancer can be an indication of more serious complications, such as pleural effusion, which occurs when fluid accumulates between the layers of the pleura. This condition can not only intensify the pain, but also make breathing difficult, requiring immediate medical intervention. It is vital that any new chest pain or change in existing pain patterns be evaluated by a health professional, especially in individuals with a history of smoking or prolonged exposure to carcinogenic substances. Early investigation and treatment are crucial for managing pain and addressing the underlying disease effectively. Direct causes of chest pain in lung cancer. Patients. Chest pain in lung cancer patients can result from various physiological mechanisms directly related to tumor growth. One of these mechanisms is the expansion of the tumor within the lung tissue, which, as it grows, can exert pressure on the surrounding nerve endings. This increased pressure can cause significant pain, especially when the tumor is located near the chest wall. Additionally, the tumor can directly invade the chest wall, involving the ribs and intercostal muscles, leading to sharper and more constant pain, aggravated by chest movements such as breathing and coughing. Another direct cause of chest pain is the infiltration of cancer into the pleura, the membrane lining the lungs. This condition is known as malignant pleurisy and is characterized by inflammation of the pleura, which can cause sharp, stabbing chest pain with each breath. As the cancer progresses, there may be an accumulation of pleural fluid, pleural effusion, increasing pressure on the lung and intensifying pain. This fluid buildup also reduces lung expansion during inhalation, causing breathing difficulties and increasing chest discomfort. Pleuritic pain and pleural effusion are indicators that cancer is at an advanced stage, necessitating immediate clinical management to alleviate symptoms and improve the patient's quality of life. Risk factors associated with lung cancer. Lung cancer is strongly associated with several risk factors, with smoking being the most significant and well documented. Studies indicate that smoking is responsible for about 85% of all cases of lung cancer due to the presence of carcinogens in tobacco that cause mutations in lung cells over time. Current and former smokers are at higher risk, but exposure to secondhand smoke can also significantly increase the likelihood of developing the disease. Moreover, the number of cigarettes smoked daily and the duration of the smoking habit exacerbate the extent of the risk, highlighting the importance of effective smoking cessation policies and prevention of passive smoking as key measures in reducing the incidence of lung cancer. Other risk factors include prolonged exposure to environmental and occupational carcinogens, such as asbestos, arsenic, radon, chromium, nickel, and polycyclic aromatic hydrocarbons, which are often found in certain work environments. Exposure to asbestos, in particular, is notorious for its risk, especially when combined with smoking, exponentially increasing the chances of developing lung cancer. In addition, indoor and outdoor air pollution contributes to the risk, with fine particles and pollutants capable of penetrating deep into the lungs and causing long-term damage. Therefore, minimizing exposure to these environmental and occupational factors, along with controlling smoking, are essential for the primary prevention of lung cancer. Diagnosing lung cancer through symptoms. Early diagnosis of lung cancer is crucial for improving patient survival rates, and identifying early symptoms, such as chest pain, plays a key role in this process. Chest pain can be one of the first warning signs that leads individuals to seek medical attention. When accompanied by other symptoms such as persistent cough, unexplained weight loss, and fatigue, chest pain may indicate the need for more in-depth diagnostic investigations. Chest X-rays and computed tomography scans may be recommended to visualize the size, shape, and location of abnormalities in the lungs, facilitating the detection of tumors at early stages when they are more treatable. Additionally, the presence of chest pain can also be an indicator for more specific diagnostic procedures, such as bronchoscopy or lung biopsies, which are essential for confirming the presence of cancer. Bronchoscopy allows doctors to view the internal airways of the lungs and collect tissue samples for pathological analysis, while biopsies can determine the type and stage of cancer, thereby informing the most appropriate treatment plan. Recognizing and promptly responding to chest pain and other associated symptoms can therefore accelerate the diagnosis of lung cancer and significantly increase the chances of a successful treatment outcome. Diagnostic methods for lung cancer. The diagnosis of lung cancer involves a series of advanced technologies and procedures that enable precise detection and characterization of the disease. Initially, the process generally begins with a chest X-ray, which can reveal masses or abnormalities in the lungs. For a more detailed analysis, computed tomography, CT, is often used, providing high-resolution images that help identify the location, size, and shape of tumors, as well as possible spread to nearby lymph nodes. In cases where these tests indicate the presence of a potential malignancy, additional procedures such as positron emission tomography, PET, may be employed to assess the metabolic activity of the tumor, offering valuable information about its behavior and potential aggressiveness. Beyond imaging techniques, the diagnostic confirmation of lung cancer often requires the collection of lung tissue samples through biopsies. These samples can be obtained by various techniques, depending on the location and accessibility of the tumor. For instance, bronchoscopy is used to visualize the airways and collect tissue from tumors located within or near the bronchi. For more difficult-to-reach lesions, procedures such as CT-guided needle biopsy or even exploratory surgery may be necessary. These samples are then microscopically analyzed to determine the presence of cancer cells, the type of lung cancer, and molecular characteristics that may influence treatment choice. This comprehensive and multifaceted approach is essential for accurate diagnosis and planning an effective therapeutic strategy. Lung cancer. Prevention. Lung cancer prevention primarily focuses on mitigating known risk factors and promoting a healthy lifestyle. Quitting smoking is the most effective and well-established measure to prevent this disease, as smoking is responsible for the vast majority of lung cancer cases. Public health campaigns that encourage smoking cessation, whether through educational programs, psychological support, or nicotine substitutes, have been shown to significantly reduce incidence rates. Additionally, avoiding exposure to secondhand smoke, which is also a significant risk factor, is important. The adoption of regulations limiting smoking in public places and work environments is another strategy that can help reduce exposure to tobacco and its harmful effects. Other preventive measures include reducing exposure to occupational and environmental carcinogens, such as asbestos, radon, and atmospheric pollutants. Businesses and regulators must ensure that occupational safety and health standards are strictly followed to protect workers in high-risk industries. Furthermore, adequate indoor ventilation and implementing measures to test and mitigate radon presence in homes are also critical. Besides avoiding carcinogens, promoting a diet rich in fruits and vegetables and maintaining a healthy weight are recommended, as evidence suggests these factors may have a protective effect against various types of cancer, including lung cancer. Thus, approaches to prevent lung cancer should be holistic, encompassing public health policies as well as personal lifestyle choices. The impact of nutrition on lung cancer. Risk. The relationship between nutrition and the risk of developing lung cancer has been the subject of numerous studies, highlighting the importance of a balanced diet as part of a preventive strategy. Research suggests that a diet rich in fruits and vegetables may offer protection against lung cancer, particularly in individuals who have never smoked. Phytochemicals found in these foods, such as carotenoids, flavonoids, and vitamins C and E, have antioxidant properties that help neutralize free radicals in the body, reducing DNA damage that can lead to cancer. Additionally, these compounds may enhance immune function and inhibit the growth of cancer cells. While the impact is more modest in smokers and former smokers, incorporating an abundance of fruits and vegetables into the diet is still recommended as part of a healthy lifestyle. On the other hand, diets high in processed and red meats have been associated with an increased risk of various types of cancer, including lung cancer. Harmful compounds formed during the processing or cooking of these meats at high temperatures can contribute to cancer development. Studies show that replacing red and processed meats with alternative protein sources, such as poultry, fish, legumes, and nuts, can reduce the risk of cancer. Therefore, adopting a Mediterranean or plant-based diet, which emphasizes the consumption of whole foods and minimizes the intake of processed meats, can be beneficial not only for the prevention of lung cancer, but for overall health. Awareness of dietary choices is a crucial part of cancer prevention, complementing other important preventive measures such as smoking cessation and reducing exposure to environmental carcinogens. Potentially carcinogenic foods. Numerous studies have explored the relationship between certain types of food and the increased risk of cancer, identifying some as potentially carcinogenic. Processed meats and red meats are often at the center of these discussions. Processed meats, such as sausages, bacon, and ham, contain preservatives like nitrates and nitrites, which transform into carcinogenic compounds called nitrosamines in the body. Furthermore, cooking red meats at high temperatures, such as in barbecuing or frying, can lead to the formation of heterocyclic amines and polycyclic aromatic hydrocarbons, both known for their carcinogenic properties. These compounds can induce DNA mutations that potentially lead to cancer development, including lung cancer, especially in individuals with genetic predisposition or other risk factors. Besides meats, other foods and beverages have also been linked to increased cancer risks. For example, excessive alcohol consumption is associated with a higher risk of various cancers, such as mouth, esophagus, liver, and breast cancer. Research indicates that alcohol can act as a solvent, aiding other harmful substances like tobacco to penetrate tissues more easily, and is metabolized in the body into acetaldehyde, a toxic and carcinogenic compound. Therefore, limiting alcohol consumption and avoiding processed and high-temperature cooked red meats can be an effective strategy to reduce cancer risk. Awareness of these dietary factors is essential for cancer prevention and should be an integral part of public health guidelines. Benefits of a healthy diet in cancer. Prevention. Adopting a healthy and balanced diet is a fundamental strategy in cancer prevention, as nutrients obtained through food can provide significant protection against the development of cancer cells. A diet rich in fruits, vegetables, whole grains, and legumes provides an abundance of antioxidants, such as vitamins C and E, carotenoids, and flavonoids. These compounds combat free radicals, unstable molecules that can damage the DNA of cells, a common precursor to cancer. Additionally, these foods are rich sources of fiber, which helps regulate the digestive system and may reduce the risk of colorectal cancer. The Mediterranean diet, for instance, is widely studied for its protective effects against various forms of cancer, emphasizing the consumption of olive oil, omega-3 rich fish, and a wide variety of plants that provide essential nutrients and bioactive compounds. Besides the benefits of plant-based foods, reducing the consumption of red and processed meats is another crucial preventive measure. These products are often high in saturated fats and chemical compounds formed during processing or high-temperature cooking, which have been linked to an increased risk of various types of cancer. Replacing these meats with alternative protein sources, such as poultry, fish, or plant-based proteins like beans and lentils, not only reduces this risk, but also contributes to a more balanced nutritional profile. Therefore, making conscious food choices and maintaining a diet centered on natural and minimally processed foods can significantly decrease cancer incidence, in addition to promoting overall better health and long-term well-being. Lung cancer treatment. The treatment of lung cancer varies considerably based on the type, stage of the disease, and the overall condition of the patient, but the main modalities include surgery, radiotherapy, and chemotherapy. Surgery is often employed in the early stages of lung cancer, especially when the tumor is localized and has not spread to other areas. Surgical procedures can range from minor resections, where only a small part of the lung is removed, to complete pneumonectomies, which involve the removal of an entire lung. The decision to undergo surgery depends on various factors, including the patient's lung function and the location of the tumor, aiming to maximize the removal of cancerous tissue while preserving as much healthy lung tissue as possible. Radiotherapy and chemotherapy are used either alone or in combination with surgery, depending on the nature and progression of the cancer. Radiotherapy uses high-energy radiation to destroy cancer cells and is commonly applied when the tumor cannot be completely removed by surgery or to treat cancers at more advanced stages. This treatment can be targeted very precisely to minimize damage to surrounding healthy tissue. Chemotherapy, on the other hand, involves the use of anti-cancer drugs to kill cancer cells or prevent their growth and spread. It can be administered before surgery to shrink the tumors or after the operation to eliminate any remaining cancer cells. In many cases, a combination of chemotherapy and radiotherapy is used to increase the effectiveness of the treatment, especially in small cell lung cancers that tend to be more aggressive and less responsive to single interventions. The importance of emotional support. During treatment, lung cancer treatment is a complex and often exhausting process, not only physically, but also emotionally. For patients, dealing with the diagnosis and subsequent treatment challenges can be deeply disturbing, highlighting the crucial importance of emotional support. This support can come from various sources, including mental health professionals, support groups, friends, and family. Integrating mental health care into the treatment plan can help reduce anxiety, depression, and stress, which are common among cancer patients. Having access to a psychologist or psychiatrist can provide a safe space to discuss fears and concerns, as well as develop strategies for coping with the emotional impact of cancer. In addition to direct support for the patient, it is equally important to provide support for families and caregivers who often face their own set of emotional challenges. Caring for a loved one with cancer can be physically draining and emotionally overwhelming, leading to feelings of fear, helplessness, and fatigue. Support programs for caregivers can offer educational resources, support groups, and access to counseling, helping them better manage their responsibilities and maintain their own mental health. Adequate support for families and caregivers not only improves their well-being, but also empowers them to provide the kind of compassionate and effective care that patients need during lung cancer treatment. Recent research in the field of oncology has deepened the understanding of the mechanisms linking chest pain to lung cancer, offering new insights into the diagnosis and management of the disease. Clinical studies and case reviews indicate that chest pain, when associated with lung cancer, often correlates with disease progression to the pleura or involvement of the chest wall. Such studies highlight that chest pain can be an early indicator of tumoral invasion into vital structures, which may require specific diagnostic and therapeutic approaches. The research also suggests that the intensity and nature of the pain can vary significantly depending on the location and stage of the tumor, reinforcing the importance of a detailed clinical assessment for proper symptom characterization. Furthermore, recent advances in biomedical imaging and molecular biology have enabled researchers to identify specific biological markers associated with pain in lung cancer. For example, imaging studies such as PET-CT have proven valuable in precisely locating bone metastases or identifying pleural effusion, both potential causes of chest pain in lung cancer patients. Concurrently, genetic research is exploring how specific mutations in cancer cells can influence pain manifestation, paving the way for personalized therapies that not only target the tumor, but also alleviate the painful symptoms associated with it. This integrated approach significantly improves the patient's quality of life and optimizes the clinical management of cancer. Lung cancer remains one of the most lethal forms of cancer globally, but understanding its symptoms, such as chest pain, and promoting early diagnoses can significantly increase the chances of successful treatment and survival. It is vital that individuals, especially those in high-risk groups, such as smokers and people exposed to occupational carcinogens, be vigilant about warning signs. Early detection, through symptom recognition and the use of advanced diagnostic technologies like chest X-rays and computed tomography, can enable more effective and less invasive interventions. Additionally, lung cancer treatment has evolved, with options ranging from surgeries to innovative treatments such as targeted therapy and immunotherapy, offering hope for improved quality of life and extended outcomes. In this context, awareness of risk factors and symptoms of lung cancer is crucial. Educational programs and public health campaigns should emphasize the importance of quitting smoking, minimizing exposure to known pollutants, and maintaining a healthy diet as effective prevention strategies. Moreover, regular checkups and timely medical consultations are essential, as they allow potential issues to be identified and treated before they progress to more severe stages. Therefore, it is imperative that everyone take an active role in managing their own health, seeking information, participating in routine screenings, and adopting a lifestyle that minimizes the risks of serious diseases like lung cancer. As we continue this journey of raising awareness about lung cancer, it becomes clear that every choice we make and every habit we adopt can shape our future. But what will you do next with this information? Will you ignore the signs your body might be sending, or will you take proactive steps for a checkup? Remember, the power to change your health trajectory is in your hands. Don't wait for alarming symptoms to start worrying about your lung health. Let's make healthier choices together and strive for a cancer-free life. Stay tuned for the next video, where we'll explore more about how your diet can be a powerful ally against cancer. Don't forget to subscribe, activate the notification bell, and leave your comment below. What would you like to know more about health and prevention?